Assalamu alaikum and good day, everyone. First, I would like to thank the Ministry of Health Iran and the organizing team of the ICHPE 2022 for inviting me to this conference. I'll be sharing our experience of a private medical institution in Malaysia on online clinical education and assessment during the COVID-19 pandemic. Clinical teaching is a full-time hospital-based experience supervised by both a qualified clinical supervisor and a school supervisor in a monitoring role. And the objective of the clinical education is to provide opportunities of acquisition and demonstration of instructional knowledge and skills by the trainees. Over the years, clinical teaching has been transformed from process-based education to competency-based medical education. Clinical teaching in health profession education is delivered at workplace and often assessed by the tools of workplace-based assessment. And the popular tools in undergraduate and postgraduate medical education are the mini-CX and DOPS. Online clinical teaching during the COVID-19 pandemic was a new experience for many of us, but during this unprecedented challenging time, some of us researched to investigate clinical teaching, relying on demand resource theory and combining pedagogy with technology. You may call it technagogy. New educational policies facing the unprecedented challenges of COVID-19 crisis was imperative, though there was a fast move to emergency remote teaching during the pandemic. Faculty was demanded to research and publish besides teaching and assessing. Teaching involved a small group discussion like PBL, CBL, and TBL were promptly and swiftly moved to online synchronous session with required training of faculty in technology using e-learning resources. However, faculty had added responsibilities to gradually digitalize teaching and learning plan, providing 20 to 30% learning materials online, creating micro-learning contents, and adopting to innovative individual group readiness assurance tests as IRAT and GRAT, virtual medical clinics and reflective practice, and the concepts of partial credit in assessment, which I will share with you in a moment. However, to move bedside teaching online was a daunting task that I worked with e-learning staff and guided pedagogies of the available models of Kolb's experiential cycle, Gainey's 9 events model, hypothetical-deductive and think-aloud approaches, Gibbs reflective practice, metacognitive skills, and micro-learning approaches to enhance the learning experiences online. Here, I would like to share with you one of the micro-learning content, which is from one of my lectures in ENT, and it's about IDL, indirect laryngoscopy. Most of the micro-learning contents are created as a skills procedure. Good day, everyone. I'm Professor Shahid Hassan from School of Medicine, IMU, with micro-learning course on laryngeal examination. The current micro-learning content of this course is first of a series of 3 skills procedures required for semester 7 students in their task-based learning theme of homeopathic. Every student must know how to demonstrate, observe, and record it. The mirror view will show orientation of. In constraint of time, I will stop here to move on. Students' engagement was ensured through pre-class asynchronous sessions using voice-over recorded lecture on and the principles of adult learning, topic learning outcome, and guidelines of online delivering, together with the test of prior knowledge. Besides in-class activities of readiness assurance tests using IRAT and GRAT, and post-class visit to virtual medical clinic and reflective practice was further used to ensure students' engagement. I will show you some of those links, such as here, the learning outcome and the introduction and delivery material with links were provided to students through their group leaders. And this link will tell exactly how the group is divided into subgroups, the learning outcome of each subgroups, and what are the delivery methods, and what would be the assessment tool after the session as post-class self-assessment tool involved in this session. Next, I may also show you another 5 to 6 slides voice-over recorded lecture, which is about how best adults can learn so that students can polish their learning skills. So these are created to let them know the best methods of learning that can bring the information given to them from short-term memory to long-term memory. Further on, the test of prior knowledge, again, are provided with links where students goes through the test of prior knowledge as we would do it in face-to-face session, but that was done in class, but this is done prior to the class so that they are motivated and prepared to attend the class. Now, moving on, some of the popular articles that we published during the COVID pandemic, for those interested participants are here for your download. You may scan QR codes to download these articles. However, some of the educational principles we followed in creating bedside teaching online was named, we named it as BEST, and the online OSCE we named IOSCE, or the integrated OSCE, are shown in these two infographics. Keeping with this presentation allocated time, I will briefly talk on assessment modifications from face-to-face to online mode using this hierarchy. Online assessment was strategized with more room for formative assessment, provided with feedback opportunities. Summative assessment was practiced as open book exam, and then there are some future assessment options of metaverse. Formative assessment was organized into pre-class, in-class, and post-class strategies, whereas summative assessment was considered mainly with the open book exam. However, IOSCE was mostly in trial phase all this while and used in formative assessment only. In-class assessment mostly employed poll survey, IRAT and GRAT, while post-class assessment was a student's self-assessment visit to virtual medical clinic and their reflective writing with feedback option. Pre-class assessment had the option of assignments and were often used. Open book exam in summative assessment were done with both proctoring and without proctoring online system. Online assessment use OAS and Moodle on LMS. However, the core methodology of face-to-face practice of assessment was maintained. The post-hoc evaluation of assessment was done through psychometrics and data analytics for continuing quality improvement. The partial credit assessment using digital scratch system was created to allow partial credit in OBA, informative assessment only. Not to forget, some of those future option of Meta was here. Core methodology of good assessment practice was ensured prior to online assessment through blueprinting of the assessment, online vetting, and standard setting using modified engulf and borderline regression method in OSCE. Online banking procedures were also used, and faculty was trained how to create items for how to create items and bank in the question bank. Continuing quality improvement was ensured by psychometrics in terms of reliability, validity coefficients, item analysis, and data analytics as the future project. Metaverse option in future may consider the augmented and the virtual reality tools. Assessment of clinical competency was recommended using a research model of integrated OSCE and reflective practice, however, informative assessment only. These are the innovative learning tools of IRAD, GRAD, and virtual medical clinic use informative assessment successfully with the students' positive reflection. Continuing quality improvement with data analytics is the future of to monitor the students' visits to all those formative assessment options provided online. Here I may show you the GRAT. So we create the 5 to 10 items OBA as IRAT and GRAT. For IRAT, the items are students are first will go individually through the same question, which are later provided to them. So this is IRAT. Then later it is provided to them to do as a group, and usually their performance improves when they do it as a group. So they have to enter their group, for example, 2 here, and start. So the one of the representative from the group will download this link, and then he will read the question, and all the students will discuss and agree to scratch one of these questions for right answer. For example, this.
Good job.
And then they would continue for next, they would again read the question and discuss among themselves and decide to correct.
Please try again.
Similarly, they continue until they finish and the score is provided to them. In the same way, I can also show you the virtual medical clinic, if time permits me. The student, after the session, will visit the virtual medical clinic for their self-evaluation. They will have a patient and doctor encounter, and this encounter will have questions for students. They have to, when they watch through this video, and they have to actually do the questions or the quizzes, and end of the day, they have to evaluate themselves. The summative assessment by open book examination, and usually the belief is the OBA are assumed to being easier, have poor discrimination between the students' performance, and allows higher passing rates, especially without the proctoring. So in such situation, we actually opted to create items with test of high order thinking. The closed book and open book evaluation was also evaluated with robust method, statistical method. And as you can see here, there is a significant difference between the closed book and open book exam with and without proctoring. But this statistical significance was also matched with the effect size or the practical impact. And we found the practical impact was very small, 0.096. So there was not much difference practically between the closed book exam and the open book exam. In summary, in any emerging crisis like COVID pandemic, medical institutions should develop methods and experience to deliver clinical teaching, no matter with some compromises from show how to know how level of clinical competency. We further recommend that emphasis be given to monitor students' self-evaluation in a formative assessment environment to ensure feedback in assessment in clinical education online. With this, I would like to thank you all.